and it's responsible for synapsing of fibers from the optic tract into it, and they will terminate by forming the optic radiation at the end. All right. So again, you can identify on this one, you have optic nerve and then optic chiasm and then optic tract and then optic radiation at the end. And these are some swelling that are present there. Looks like the cerebral peduncles. So this is the optic nerve. Just to summarize the bit that I was talking about, the injuries that can happen and what will be the sequelae of these injuries. So basically, I'm going to ask you a few questions and just try to be sort of rational thinking about it. So basically, let's say we know now that the nasal side of the retina is responsible for the temporal field, and the temporal side of the retina is responsible for the nasal field, right? So I'm going to ask you a few questions. Try to imagine, what if you started cutting these fibers? What do you think is going to happen to the patient? So basically, all the impulses that's coming from the nasal side will not be able to cross. And from the temporal side, so temporal side and nasal side are unable to cross. So the patient will be blind on this side. Of course, if you cut it on the other side, the patient will be blind as well. So injury to the optic nerve leads to unilateral blindness or ipsilateral blindness. What about optic chiasm? What about the patient you started cutting here? So basically, the fibers from the nasal side of the retina on this side will not be able to cross or pass.